A pleasant day and a warm welcome to your favorite show, I Made, a program where we discuss medical concerns and giving you advices for a successful life in order to prevent from diseases. So ladies and gentlemen, we were following numerous topics on IMED, and today we are going to discuss about skin infections, which is a commonly discussed criteria and which might be very essential for maintaining your daily routine. And to do the honors with us, we do have Dr. Januka Galahitiava, consultant dermatologist. Thank you very much, madam, for taking part in our discussion I made. So madam, to start off today's topic, skin. So what really skin infections are?
Yeah, when considering the skin diseases, it's a vast there is a vast variety of skin diseases. Out of that, there are lots of skin infections which could be acute, that is short term, and also which could be chronic, that is long term. Along with the infections, there could be skin inflammatory disorders which can be lead to secondary infections as well. So there is a group of disorders of skin inflammatory diseases. And also there are other variety of skin diseases, maybe skin cancers or skin diseases due to skin diseases and problems due to skin applications, and lot of other. So when you are considering the skin infections, it could be either viral, fungal, parasitic infestations, bacterial infections. So it is also a vast variety of where there is a vast variation in the skin diseases.
Madam, when it comes to certain diseases, there are many. So as you mentioned, viral, bacterial, fungal, there are many. So basically people concern a lot about the skin. So even when we scratch the skin, when the skin is dry, it appears to be whitish, and sometimes with a certain slap or something it becomes reddish, or sometimes with certain conditions it becomes blackish. So there are some ordinary contexts that we meet in day-to-day life. So before moving out to the diseases, can you just explain how to basically identify when there is something wrong with the skin?
Yes, when actually when you talk about skin symptoms that which you have, symptoms and signs, there may be itching, and also as you are mentioning, it would be too dry skin, also may be some sign of skin diseases, and too oily skin also could be a sign of skin disease and leading to skin diseases. Certain skin diseases, there could be patches of dark patches, white patches or reddish patches depending on the skin illness, and also there could be erythema, redness around the lesion, or warmth on the lesion, and so these are the skin signs and symptoms. And also there could be warty lesions. So but when you talk about warty lesions, there are lots of warty lesions which could be maybe infections, maybe skin cancer, or the infections also maybe it could be varied. So when you talk about warty lesions, first of all we can talk about viral warts. So viral warts is a common illness in mainly in young children, and but it can affect any age group, and it can affect any part of the body. Commonly on hands and feet it occurs, but it could be on mucosal membranes, that is as genital warts, or oral, even on the lips. And there is a picture, actually you can see the warts appearing on different sites, and that this is the viral form. So viral in small children, the viral warts could even these common viral warts could disappear with the time. Maybe in 6 months or up to 2 years, it can disappear on its own in young children, but not in adults, because the main reason there are these viral warts, we might think that it is viral wart, but it is not, maybe not a viral wart even, because there are other warty lesions which occurs as warty lesions, where especially when we consider deep fungal infections. There is a specific deep fungal infection called chromoblastomycosis. There is a picture there. It's a very large warty lesion, but it is a deep fungal infection. The treatment differs from the viral warts. They don't disappear on its own at all. Mostly this is a disease of elderly, mostly in farmers, and even others could have this, and we have to treat with antifungals along with liquid nitrogen freezing therapy. And also there are these other warty lesions. There are wart-like lesions in leishmaniasis. It's a very common thing. Many people do know about leishmaniasis. They are aware of leishmaniasis. This vector is a sandfly. Where the sandfly is more prevalent, these leishmaniasis you can find. And earlier it was a disease appearing in the north and northeast, but unfortunately now it has spread to most part of the country, and we see cases of leishmaniasis in many parts of the country. And for this we have to treat, because this mostly causes a warty lesion, ulceration, which does not heal with the antibiotics and things like that. So we have to give specific treatment, sometimes this liquid nitrogen freezing, or specific treatment of there are injection forms and things like that for this leishmaniasis. And also there are other warty lesions like these common black warts. These elderly, I mean after 30s, 40s, you tend to get these black warts on your face, neck, and elsewhere in the body. It is partly genetic, because when they have a lot, there is a genetic predisposition most of the time. The parents or siblings, they do have it as well. And the skin tags, the other form of warty lesions, they are with it comes with obesity, and as well as it is also running in the family as well. All these are not infections. These are our brown skin color problems, but because of the cosmetic issues, because it's when it is growing multiple and bigger, then it becomes ugly, so we remove them. We can remove them without scarring easily with electrocautery. And on the same picture there is another region. Actually it is a nevus. Actually it comes it grows with the age, but it comes at birth. It presents at birth and it grows with the age, but if you try to electrocautery and remove it, sometimes it can scar. So it is very important to diagnose the condition before you go into treatment. So many people, they think now these are these black warts, we can remove them. They just go here and there without taking any more medical advice, proper medical advice. Sometimes they fall into trouble, because all these warty lesions are not warts, not viral warts, and neither the black warts. And also they could be even more sinister things presenting as warty lesions. In the next picture, actually it is a basal cell carcinoma, which is a low grade cancer, which can if it is persistently growing for many years, it can affect the underneath structures. But usually basal cell carcinoma, if you diagnose early and remove early, that is the treatment. Just taking it out and just excising and taking it out is the sole treatment. You don't have to go for any other treatment at all. But early diagnosis is very important. So just ignoring warty lesions on your face or elsewhere might cause trouble if it has been there for a long while. So it's better to get a medical advice when they are, because especially this warty lesions, these basal cell carcinomas could be there in the middle of these other black warts, but this is different. So that difference could not be identified, sometimes could not be identified by the normal lay people unless you go for a doctor's medical advice.
That means, madam, in that case, some conditions, they are a combination of different types of diseases. So without proper medical attention and advice, if we treat our own or if we neglect them, we'll be in trouble.
Yes.
Madam, are there any other diseases which regard to certain other things, like for example, a common disease is in ordinary term, we term it as aluham. So yes, can we talk about that?
Yes, these are, when you talk about, now earlier we talk about water lesions, now we talk about these patches. So the common patches, they are whitish with a slight scale on the skin, involving the face, back, chest commonly, but it could be even all over the body. It could be, this is what you call aluhang, is a fungal infection, but it is a commensal flora. That means that we have our own fungi on the body, but due to an overgrowth of this fungus, it causes this fungal infection. So we can treat with this local applications of antifungals, and if it is severe, we have to go for oral antifungals as well. And also there is another form of fungal infections, we call it as ringworm, because it present as a ring like lesions on the body. It could be on the groins or elsewhere, and this is quite common in people with diabetes and other immune suppressive illnesses. And also it is very common among this young age group, sportsmen and all that. It could affect in between toes or on the face, or according to the site we call different names, but that is there are lots of medical terms. And also the main thing is, people think that when they have a patch, they just go and buy something over the counter, and most of the time this happens to be either a steroid cream or these combination creams. Actually, applying these combination creams and strong potent steroids on these fungal infections, it shows like as though it is going down, but definitely it is not going down. Underneath it spreads like nothing. And sometimes in spite of proper treatment, also it takes a long time to get rid of this type of ringworm infections, this fungal type of infection. So it is very important to diagnose the case and apply the antifungal alone. If you mistakenly apply steroid creams on these patches, it takes long while to treat and get rid of it, because it spreads on your own body, as well as it can spread to the others in the family members, friends and contacts as well. So those are the fungal infections. And other patches which can occur on the body, like fungal infections, there could be these whitish patches appearing on the body. It is a common disease which is called leprosy. People get scared when you tell about leprosy, but it is a disease which we have treatment, permanent. It can be permanently cured. And we can prevent complications by diagnosing the disease early and treating it properly. So when you have hypopigmented, that means whitish patches, may be small, may be large, for a while, maybe weeks, months or years, you might be having persisting patches, and it can spread slowly. And there are different kinds as well in leprosy. It's another separate topic you talk about, but I just wanted to mention that it has treatment, and it is there among our population, so it should be identified and treated properly. And
moving ahead with madam, some other diseases like skin lymphomas, what can we talk about them?
Yes, that's a thing. Even skin lymphomas also could present like these whitish patches on the body. There is a picture, actually this patient was referred to me in one of the wards, telling that the patient is having severe aluhang, this fungal infection, but it happened to be skin lymphoma. So there is specific treatment. Actually, skin lymphoma, when it is diagnosed early, we can treat without even going for chemotherapy and this cancer treatment, though it is a low grade cancer. But if we just leave it for a long while, it can spread to the internal organs. So it is very important to diagnose it early and treat.
Right. Okay, madam, like we discussed many diseases, those are sometimes they will be having a genetic predisposition or any other causative factor behind those things, and ordinary people, they have a common issue with regard to those skin applications. And what are the problems related to skin applications?
Yes, actually a lot of problems, because nowadays with this open economy and with the advertisements and all that, people are applying many applications on the faces, not only the females, now even the males, small children, elderly people, everybody is applying applications. And due to applications, lots of things are coming up. Actually, I have to mention specifically about the skin lightening agents. Skin lightening agents comes in either creams, or even there are tablet forms, and although banned, there are these injection forms as well. So people are widely using this and falling into trouble. So especially when you mention the whitening creams, they have this mercury, arsenic type of heavy metals in high concentrations, which can lead to skin cancers or internal organ damage. And also these bleaching agents can lead to, actually they are thinking that the skin would become white, but instead it can become very dark, which is very resistant to treatment due to these hydroquinone type of bleaching agents available consisted in these creams. And also the major issue is that many of these whitening agents do have potent steroids, very strong steroids, which you are not supposed to apply these type of creams even as medications for the face and neck area, but people are applying these creams on the faces and things, and cause and stretch marks, facial hair, the hirsutism we call, that females grow facial hair because of these creams containing steroids. And skin atrophy and also the skin aging is very prevalent in this. After applying these creams, the skin aging can come quickly. Actually, in our brown skin, we have this advantage. Our skin age slowly when compared to the Western countries where they have the fair skin. We have this type 4 skin type because we have melanin in our skin, dark melanin. Melanin is the pigment which we have on our skin, causing the skin to brown to black color. And this is, we think that it's not nice, but it is very advantage. It is a big advantage to have melanin on our skin that prevents us from having skin cancers, because in other Western countries they do have a lot of basal cell carcinomas and a lot of melanomas when compared to our Sri Lankan skin. And also their skin aging is quite quickly. In 30s, 40s they have wrinkles, but in our country, in Sri Lankans, we don't have that. So we must be proud about that. Yes, but the people are applying all this whitening stuff, and this is leading to skin thinning, and skin aging becomes quicker, and they are falling into trouble. They are trying to change their own identity by applying these things and trying to change the things. So yes, and madam, with that, like can we just give some tips for a healthy skin maintenance for our viewers? Yes, people think that we should have a fair skin to be beautiful and have a nice skin, but it is totally different. We should have healthy skin to have a beautiful skin. So to have a healthy skin, we should use certain things. Actually, you have to use a mild cleanser to wash with, and also if you are wearing makeup, you have to select the makeup according to the skin type. And maybe if you are having oily skin, you should not use oil based makeup. then you can have acne. And also you have to use a moisturizer, and that depends on the body part, whether it is on the face or body, and whether the person is having very dry skin or very oily skin. You have to choose the moisturizer. And also sun protection. When we are living in a country like this, though we have melanin, we have to protect our skin from the sun, harsh sun especially some occupations we tend to expose ourselves to the harsh sun most of the time. So then we have to use a sun cream. The important thing is you have to wear the sun cream before going out in the sun, at least 20-30 minutes before. And also you should reapply it after 2-3 hours if you are again exposing yourself again to sun.
Right. So with that, madam, with that proper treatments that we are going to implement, any other like specific treatment methods that we can adopt to maintain our healthy life?
Yes, there are these specific treatment. Actually, we have to treat the tablet forms and injection forms according to the illnesses, and also there are these, we use these treatment procedures. These treatment procedures could be PRP, that is platelet rich plasma treatment, or chemical peeling, or laser treatment. According to the illness, according to the skin problem, we select the treatment modalities. So these as I was telling before, for these viral warts, we use this cryotherapy, liquid nitrogen freezing technique, and this black warts we use electrocautery, and we remove them without any scarring or damage. So there are lots of treatment modalities to overcome all these skin diseases, plus the skin problems which are not actual diseases but mainly causing cosmetic issues.
And with medical advice we can proceed with the very best matching treatment to our healthy skin. And madam, like people tend to buy some ointments, creams, various other things for specific diseases. They think that they say certain names, brand names, and they buy over the counter from pharmacies and they apply. What is the effect of wrong medication here in dermatology?
Yes, that is quite common in dermatology, because people think that most of the skin things are being seen to the outside, so they just go and show it to the pharmacy people, or they think that it is a fungal infection or eczema or whatever, and they treat on their own. And so they go and, as I mentioned you before, if you buy a steroid cream to treat a fungal infection, it could become really severe and cause problems, and it would take a long time to get rid of the infection. And also, if you treat with antifungals for the eczemas and psoriasis and things like that, it won't get cured at all. And also, especially when you have this pigmentation on the face or elsewhere, people think that they can just apply all these cosmetic applications and get rid of it. But sometimes these pigmented lesions could be due to certain disease conditions. In example, even it could be a skin cancer, it could be a melanoma. I'm not telling that melanoma is common in Sri Lanka, but it is prevalent.
There can be such cases.
Yes, and we should, when a pigmented lesion, pigmented patch is there, it could be melasma, just pigmentation, or it could be a birthmark, or it could be freckles, but just applying these bleaching creams and things like that won't resolve all these problems. So you have to get the specific treatment according to the diagnosis. So you have to consult a dermatologist to get the proper advice and get the proper treatment or treatment procedures.
And madam, finally, as a final question I'm going to ask you, we people sometimes try to change our skin color. What is the color of beauty behind this subject?
Yes, actually many people, they don't admire our skin. In our own people, they don't admire our brown skin. Actually, because of this, we actually implemented a program called The Color of Beauty is the Color You Own. That is in Sinhala Sudu Kalu Talelulu Api Okkoma Dakum Kalu. Actually, this is a program, it's a public awareness program tell the people about the side effects of skin whitening stuff, as well as to teach them to admire our own skin. Actually, there are lots of people internationally and locally who have gone to the top levels without changing their skin color, because we have got our brown skin color. This is our identity. This is the color we own. So there could be people, there could be lighter brown color, darker brown color, but that is a color range which we have. Because of our melanin, which protects the skin from skin cancers and without aging, so that is our protector, the melanin. So we are trying to change the skin color by changing this melanin amount, and we are falling into trouble. So to take that message, we have implemented this program, the color of beauty, the color you own. Actually, the Sri Lanka College of Dermatologists, where I'm a member as well, all the dermatologists have got together, and we are giving out this message of to maintain your natural skin color and maintain your natural beauty by not changing the skin color.
Skin color. Okay, so being a member of the College of Dermatology of Sri Lanka, so Madam gave us a message as well with this program iMed, which we encountered certain issues with regard to skin, and we educated you with regard to the common skin infections and treatments, and basically the effect of wrong treatment. So if you are suffering from such a condition, you can just take it as a certain opinion and move to a doctor with medical advice, follow proper treatment. So thank you madam very much for joining with us. Dr. Januka Galahitiava, consultant dermatologist, joined with our program iMed. So ladies and gentlemen, stay tuned with iMed for many other health tips in our future episodes as well. So thank you very much for joining, and have a pleasant day.
Falling into trouble. For example, severe acne, as the picture shows.